Premature ejaculation is a state of localized anatomical hyperreactivity. It's a mechanical failure where specific nerve networks fire at a lower threshold than intended. Mapping the anatomy reveals three structural epicenters: the frenulum, coronal sulcus, and foreskin. Inside these zones lies a high-density web of nerve fibers. They pack significantly more sensory receptors, creating a concentrated focal point for arousal signals. During physical intimacy, this concentrated density acts as a biological hair trigger. Because the nerve endings are packed so tightly, minimal friction generates a massive sensory payload, often exceeding the body's capacity to moderate the signal. Because the issue is anchored in specific anatomical sites, resolution requires a targeted structural intervention. Generalized behavioral therapy often fails because it addresses the mind rather than the hyperreactive hardware. High nerve density explains the baseline, but an invisible biological variable can drive that sensitivity even higher: pathogenic microflora. When bacteria accumulate on the foreskin's underskin, they trigger a zone of inflammatory swelling directly surrounding critical nerve pathways. A graph overlay shows the baseline neural threshold forced upward. The nerve endings remain perilously close to their firing threshold, constantly irritated even before physical contact. Correcting this hyperreactive baseline requires recognizing the body's capacity for physical adaptation. Relying exclusively on temporary chemical numbing agents leaves the underlying biological irritability unaddressed. To lower this sensitivity, we use mechanotransduction. Exposed to controlled physical stress, the body forces specific fiber bundles to reinforce and adapt to the load. Through this process, hyperreactive tissues successfully downregulate. The excessive signals are smoothed out, preserving pleasure while removing the erratic, rapid spikes that lead to premature climax. This structural vulnerability is most evident in the frenulum. For many men, this tissue band is naturally short, causing extreme mechanical tension and rapid sensory misfires during intercourse. The first protocol counteracts this tension through active stretching. The goal is to safely induce structural elongation within the frenulum tissue. The execution requires securing the tissue by pinching the frenulum from both sides. This ensures the tension is applied evenly across the structure. Once secured, downward tension is applied slowly. Synchronize this stretch with the breath, pulling the tissue during a continuous exhalation lasting 5 to 7 seconds. Structural change requires volume, 15 to 20 repetitions per session, morning and evening. This precise biomechanical intervention neutralizes the tension that causes a short frenulum to misfire, upgrading the tissue's structural tolerance rather than simply masking the sensation. In cases where the entire surface of the glans is hyperreactive, isolation is impossible. The strategy must shift to addressing the entire surface area. The second protocol uses sustained rhythmic tactile stimulation to force a systemic neural adaptation across the local nervous system. By lightly tapping the surface continuously for 3 to 5 minutes daily, dispersed shock waves are sent across the tissue. This low-level stimulus overwhelms hyperreactive receptors. The initial intense flashing of the nerve network gradually stabilizes into a steady state. Daily sensory flooding forces the local nervous system to undergo neural downregulation, lowering its reactivity threshold over time. Habitual daily exposure to controlled stress rewires the feedback loop, pulling the local system out of high alert. Biological desensitization is a gradual tissue adaptation. It is a physical reshaping of the fibers and their neural responses, not an instant chemical change. Consistent daily adherence is necessary to see results. It takes roughly 1 month of continuous compounding before these structural and neurological shifts become noticeable. The primary outcome is a significant decrease in unwanted sensory overload. The physical contact of penetration no longer triggers the same immediate surge of signals. This graph illustrates the shift. The erratic, spiking curve of the reactive state becomes a smooth, ascending response. Reaching its peak, it holds steady without involuntary climax. Physical adaptations restore conscious control over the autonomous reflex. Through consistent biomechanical conditioning, a man recalibrates his physical responses. Using localized tissue adaptation to stabilize the nervous system, he regains control over his sexual health.